Hi everyone. As you all know that May is observed as Skin Cancer Awareness Month or Melanoma Awareness Month. So the key intention is to educate people or teach you all about early signs of skin malignancies, and so that you can look for them and report to your dermatologist or treating physician at the earliest. So in today's video I would be talking about risk factors for skin cancer and prevention modalities for skin cancer. So let's talk about risk factors. Fair skin per se is more prone for development of any skin malignancies. Sun exposure is important risk factors. If those of you who spend considerable amount of time in sun, they are more prone for development of skin cancer. Sunburn. If you have a tendency to develop sunburn, or when you were a child you had blisters on your skin whenever you went out in sun, so those people are more prone for development of skin cancer as an adult. In case you are staying on high altitude or very hot climate, then you are more prone for development of skin cancer. Sometimes you have family history of malignancies or personal history of malignancy, then you are more prone for development of skin cancer. In case you have abnormal mole, or you start to notice that there is some abnormal change in your mole, like you start to notice that there is bleeding or there is bruising or there is excess scaling or the color is changing, then you must bring it to notice to your dermatologist. In case there are certain pre-cancerous lesions, like weird sort of brown spots, or like something we call as actinic keratosis, which can be seen on face or scalp. So in case you see any such abnormal growth, you must definitely report to your dermatologist. In case you have taken immunosuppression medications, because whenever you go for organ transplant, your doctor is going to put you on immunosuppressants. So those individuals are more prone for development of skin malignancies. Also, if you have undergone sort of radiation therapy or increased exposure to arsenic, so these are basic risk factors for development of malignancy. So now let us discuss about what are the ways to prevent them. Like I always keep talking about sunscreen. So sunscreen is really important part of prevention against skin malignancy. So many times what I get to hear is that, doctor, there's vitamin D deficiency which can happen if I apply sunscreen. So that's not such an important issue, but you can't have vitamin D at the risk of UV rays. So I would rather ask you to concentrate on other sources of vitamin D and always apply sunscreen. So 30 SPF is good, but in case you are staying out in sun for considerable amount of time, then you must use 50 SPF. You must also use a lip balm, and don't forget to sunscreen your lip as well. You must also cover your eyes and use photo protection, or like in terms of using sunglasses, which offers both protection against UVA and UVB. So now protective clothing also offers certain protection. So you must also wear protective clothing in terms of avoiding harmful rays, and wear wide brim hat if you are going out. In case you are taking certain medication which are sun sensitizing, then you must look for them. And in case you are on medications which can make your skin more reactive to sun, then you must definitely indulge in wearing sunscreen, and you must consult your doctor from time to time. In case there is increasing popularity about sun tanning, so I want to encourage you all not to go for sun tanning, because they are really very harmful for your skin. So you should not follow such culture. You must always check your skin from time to time, so that you start to notice any abnormal change in your skin at the earliest. In case you see there is abnormal change in your existing mole or your freckle or your bump, any bump or your birthmark, to report your dermatologist. So the warning signs would be if there is bleeding, if there is crusting, if there is scaling, or if there is sudden change, like you see that there is some color difference or certain speckles appearing in the center of the lesion, then you must report to your dermatologist. So keep watching your skin, look for your skin for any sort of abnormal change. So thank you, and stay tuned for more educative videos.